One of the bigger problems that we have in our treatment models for this thing that we call alcoholism and drug addiction is that we tend to, on assessment, only ask one real important question, and that is, are you addict, alcoholic, or not? I've got to tell you that in our business, if you go to some mental health professionals, for instance, psychiatry, psychology, you may or may not get referred to a 12-step abstinence-based model. In fact, some of those folks might see your substance use disorder as more likely caused by some other thing, depression or anxiety, and they might choose to treat the underlying cause of your alcoholism and drug addiction, and maybe that'll be a good thing. On the other hand, if you go to a local treatment center that's designed to treat alcoholism and drug addiction, they're going to assume that most of your problems are likely caused by your ingestion of the mood-altering substance. You're using too much alcohol or drugs, and that's the things that's causing the problems in your mental health issues. And so they're going to treat it based on detox, abstinence, and recovery. The interesting thing is that that's essentially the luck of the draw, who you happen to go and see. Once we ask that question, are you an addict or an alcoholic, and we decide that we're going to treat you, we essentially don't ask any other questions, and for the most part, you get the same treatment as everybody else. Rarely, if ever, do we ask any questions about what kind of addiction you have. In Alcoholics Anonymous and other 12-step programs, they have a funny saying, some are sicker than others. And maybe that's really true. And maybe some other folks on the other end of the scale don't actually need as much treatment as we usually throw at them. Rarely do we try to make this kind of distinction because we just don't have the assessment tools to do that today. We need them. And so one of the things that the Addiction Research Foundation is trying to do is come up with enough data and enough information that we can develop better assessment models. And I know this has been tried before. The research called Project Match, most people point to say that it didn't work when we tried it. But there's another way to look at it, and we're trying to find it today.